guys, today we are going to discuss about herpes simplex virus. So coming to herpes simplex virus, it belongs to family Herpesviridae, which is again subdivided into alpha, beta and gamma subfamilies. In HSV 1, 2, 3 comes under alpha, whereas HSV 5, 6, 7 comes under beta, and HSV 4 and 8 comes under gamma. So majorly we are going to discuss about HSV 1 and 2. So we will discuss about these serotypes. Okay, HSV 1 it majorly contributes to perioral infection, whereas HSV 2 it causes genital mucosal infection, whereas sometimes it will be altered. Sometimes HSV 1 may be detected in the genital mucosa, and HSV 2 may be detected in the perioral infections. Okay, and 1/3 of the newly infected individuals, these may be symptomatic. Only in every 3 individuals, 1 will be symptomatic. Okay, so lesions may develop in 3 to 7 days after the transmission of virus. These lesions may be associated with systematic manifestations like fever, malaise and tender inguinal lymphadenopathy. So at first we will observe these papules which are reddish in color. These red papules may progress into vesicles, which may further progress into painful coalescent ulcers. Okay, these lesions will be visible on the vulvar skin and mucosa. So and these lesions which are cervical and vaginal lesions, they are present with purulent discharge and pelvic inflammation. Okay, so if the lesions which are present around the urethra, patient will be presented with painful urination and urinary retention. Okay, so active infection which will be presented with the vesicles and ulcers. So these vesicles and ulcers may contain numerous viral particles. Okay, so the mucous and cutaneous lesions will be healed after 1 to 3 weeks. Okay, so sometimes this acute infection it will migrates into lumbosacral ganglia, so which may turn into latent infection, and this will persistent throughout. Okay, so recurrent infections will be occurring with patients with decreased immune function, who are immunocompromised individuals. Okay, we'll continue further. So we'll have condoms, antiviral therapies. This will decrease the risk of transmission, but not completely. Okay, so men to women transmission, which is more than women to men transmission. Previous infection with HSV 1, it reduces the susceptibility to HSV 2 infections. Infected mother, if the mother is infected with HSV, so neonatal transmission which is very common. Okay, neonates are under highest risk. So normal vaginal delivery can't be done, so C-section which is warranted in these conditions to protect the neonate. Okay, HSV infection, active HSV infection, it increases the risk of HIV acquisition even and transmission of HIV even. So how can we diagnose this condition? Diagnosis is based on the clinical findings and HSV detection. Okay, sometimes purulent exudate from the and aspiration from the lesions, and inoculation into the tissue culture should be done. So we'll see cytopathic effect after 48 to 72 hours. So by this we'll do serotyping also. So in some countries they are doing a highly sensitive tests like PCR, ELISA and direct immunofluorescent tests to detect the antibodies, and HSV detection in lesional secretions. Okay, so if anti-HSV antibodies in the serum which are detected, we will conclude that infection as latent or recurrent infection. So in primary infection, we can't find the anti-HSV antibodies in the serum. So treatment will be no effective treatment for latent HSV. even though we have some antiviral agents for this. So we have acyclovir and famiciclovir. Acyclovir will prescribe 500 mg for 5 days, for 5 times for 5 to 10 days. Okay, famiclovir also, which shorten the active symptomatic phase of the viral transmission, and ultimate treatment will be vaccination. Thank you guys, thank you for listening to me carefully. Thank you.